My name's Jaclyn Bishop and I'm a PhD Fellow at the National Centre for Antimicrobial Stewardship, located in Parkville, Melbourne, Australia. There's certainly an appreciation in the medical field of the need to preserve antibiotics, but it can be difficult when you've got patients in front of you with complex needs, and therefore antimicrobial stewardship is a program that can be put in place to support doctors. So some of the barriers to antimicrobial stewardship program implementation in regional and rural hospitals include access to infectious diseases specialists, access to pharmacy resources, access to IT infrastructure, and just geographical location. Regional and rural hospitals can look at enabling their local staff to be able to run a successful antimicrobial stewardship program. So this is their local doctors and local pharmacists who don't necessarily need specialist infectious diseases knowledge to be able to do this. What they do need is appropriate training and some time allocated to dedicate to their antimicrobial stewardship program. Alternatively, hospitals can look at engaging an external organisation to be able to assist them with their antimicrobial stewardship program. And they provide things such as policy templates, analysis of data, and undertake site visits and speak with clinicians at the rural and regional hospitals. What we'd like people to take away from this paper is that regional and rural hospitals don't need to rely on an ID specialist to be able to run a successful antimicrobial stewardship program. However, it is still important that infectious diseases advice be available when needed for complex patients. Technology has also had a really important role in allowing remote access to information that's needed to do remote assessments, but also things such as point of care testing so that regional and rural hospitals can access microbiology information more quickly is certainly very important as well. One of the knowledge gaps that we did identify is that a lot of the published papers come from the US, and there's not a large amount of information about how Australian hospitals have overcome these barriers. So we'd certainly like to see more Australian hospitals publishing how their antimicrobial stewardship programs have been developed and implemented, so that we can add that to the body of knowledge that this paper is presenting.